First, you would probably get in the morning and you would check your voice messages for calls that people are needing help or needing service of some sort. You're answering the providers. Then you would load up your computer and then you head out to your car and then set your GPS and then you go for the visit.
We're seeing more frail elderly patients. We're seeing people with a lot of mental health issues on top of their health conditions.
When they're in these situations, they can be very overwhelmed, and the last thing they can think of is how to get out there into the community and get what they need.
We are the ones that take the calls for a distressed family who are burnt out so that they're not going to the hospitals. They're not just going and utilizing these hospitals as a drop-off because they're burnt out.
I help patients have a seamless transition from hospital to home with the appropriate services that will enable them to become independent and remain in their homes.
Each patient is assessed with a standardized health assessment that helps us determine areas of risk for a patient and particular health care needs that they have. And then we provide services to support those patients within the community setting.
As a patient, having access to all these different professions within a team as care coordinators definitely is valuable.
And that's the government's goal, is to keep people in their homes so that there's more room in the hospital for people that actually need to be in the hospital.
With not having us in place, I was finding a lot of our patients were ending up back in hospital.
The risk is that they're being sent home, let's say without an OT to do a home assessment, and they're trying to use the bathroom, trying to transfer into the tub, they have a fall.
Just having a PSW, like us putting that in place for them, makes a huge difference. Yeah.
If I were a patient, if I hear the news that the CCACs will be eliminated, I would be very scared.
You can't just discharge somebody home and expect them to manage. They need connections with nurses, with physio, and with occupational therapists to ensure that everything goes well.
I firmly believe that we need to maintain our high standards of healthcare here in Ontario.
It really is helpful for people to know that we are out there and we are out there for them. We're out there in the community for them, for the patients, to help them.